Hello, everybody. You've been already hearing us talking a little bit about this exciting topic that Vincenzo L'Imperio and Andrew Smith are going to talk about today in our webinar in collaboration between Glaucom and the RPS.
Thank you very much. Thank you very much for the invitation, and we are glad to be here to share our experience. And let me just start before giving the words to Andrew that will start talking about proteomics and in situ proteomics that we do routinely in our department. Let me just start saying that Andrew is a colleague, he's a research colleague, but he's also a friend. And from the research and clinical point of view, we are like brothers because we started our careers in the university and the hospital essentially together. So we grew up together, growing our interest in renal pathology and in the application of proteomics in this field. So Andrew, the stage is yours. Please introduce the proteomic and technical side of this wonderful work.
Okay, thank you very much, Vincenzo. So I'll just start by sharing my screen.
And while you're doing this, Andrew, I would just like to say to our audience, we're going to have a session of Q&A by the end of your presentation. So I'm happy to receive all the questions that you would have in our chat room. And I'm going to try to moderate question and answer by the end of your presentation.
Okay, perfect. Can somebody just confirm that they're able to see my screen now?
I do.
Okay, perfect. So again, thank you very much for the kind introduction. But before I moved on to the nitty-gritty, I also wanted to briefly introduce where we are in Italy. So if people aren't aware, we're actually working in Monza in the north of Italy, which is a wonderful city. So there's a nice small cathedral. There's also the old Villa Reale di Monza that was left behind after the Savoia regime here in Italy. If anybody's familiar as well with Formula One, in this park here within the city, takes place every single year. But from our research standpoint, this is the perfect location here where we have the U28 Research Center of the University of Milano-Bicocca, where I work. And exactly at the side, we have San Gerardo Hospital, where Dr. L'Imperio works. And again, this really highlights that this close-knit collaboration with geographical vicinity really helps and is what really pushes this work forward. And during the last, let's say, 9 years or so, a lot of our work by using spatial proteomics is focused on two particular areas. So firstly, thyroid cytology, and more particularly in the diagnosis and personalized medicine in glomerular diseases, which is what I'm going to talk about today. So let's start off with a traditional image of a renal biopsy, which has been H&E stained, for example. Even today, the renal biopsy remains a fundamental aspect in the diagnostic assessment of patients with renal diseases. But as we know, as we're moving to a more personalized medicine era, sometimes the information that's maintained within this histological image isn't quite enough to define personalized treatment or predict what a treatment may do within the future. Which is why, of course, histology has now been frequently flanked with molecular approaches such as immunohistochemistry and immunofluorescence, which we already know their role in a variety of diseases such as membranous nephropathy. But in addition to these more traditional molecular techniques, there are also alternative molecular techniques which are currently been developed. And one of these techniques is called mass spectrometry imaging. And in a nutshell, this technology effectively enables us to visualize the spatial distribution of a variety of different biomolecules in pathological tissue. So if you want, we can think of it as a highly chemically specific version of microscopy. And one of the big advantages of this over routine histology is that we can visualize these molecular alterations before they're evident at the histological or morphological level. And because this technology maintains all of the spatial information that's present within tissue, it's a great way of unraveling all of this molecular complexity that we might find in disease tissue, in particular in renal tissue. And this is because the technology generates data in 3 different dimensions, which when put together is represented by a data cube. So in these first 2 dimensions, we have the spatial coordinates of our tissue. So the instrument at discrete pixels down to the level of a single cell will raster its way across the surface, generating thousands of spectra. Until